My name is Ekong. I'm a pediatric transplant hepatologist here at MedStar Georgetown University Hospital in Washington, D.C. My practice is full of children who have liver disease, children who need liver transplants, children who have had liver transplants. And essentially we start really from infancy, so a few months of age, or a few weeks of age really, to 18 years of age. And so we make a diagnosis of a liver disease sometimes within the first few weeks of life, and sometimes within, during the neonatal period, and I follow children till 18 years of age. When we have children who have acute liver failure, that's an emergency for us. And obviously we need to make a determination not only what's causing the liver failure, but whether that liver is going to recover or whether that child is going to need an urgent or emergent liver transplant. So we kind of do three things all at once. The field of pediatric liver transplantation has evolved over the years. And so I would say probably in the 80s, we were more focused on getting that liver to work and, slamming people with a lot of medications. And now our focus right now is really on long-term care. And so I like to tell families that our commitment when we do the liver transplants is really that your child will have that same liver and be a grandmother or grandfather with that same liver. And so our focus in the field of pediatric liver transplantation has really changed towards ways in which we can improve long-term outcome. And there's a lot that's been done in the field. And so I think that we are very optimistic about our field right now. My philosophy of care really is truly getting the family on board and having everyone have a discussion about what we think is the right approach to use in a way that makes the family comfortable as well with the decision that we come to. I treat children who have inherited diseases that cause jaundice, which is the yellowing of the eyes, and what we call chronic liver disease. I also treat immune-mediated diseases. So your immune system normally recognizes yourself as being yourself, but when things, as well as recognizing things that are foreign as being foreign. But when the immune system gets perturbed in a different way, it mistakenly looks at itself as being foreign and then tries to attack different cells. So when the immune system tries to attack the cells of the liver, we call that autoimmune hepatitis. And so I also treat children who have immune-mediated diseases as well. And then, of course, children with liver tumors, for instance, whether they be malignant or non-malignant, when they do need a liver specialist at that point in time, not separate from an oncologist, of course. Then we also treat people with infections of the liver, like hepatitis, B and C. Those are things that we also treat as well in children. Chronic liver disease, one of the things that we can see is the yellowing of the eyes. We call that jaundice. And also in chronic liver disease, people can have, because of all the bile acids sometimes that are present in the blood, we can see a lot of parents complain of children who are scratching a lot. And so those are some signs that we can see. And then children who don't grow so well. Sometimes having a chronic liver disease can cause that. In terms of acute liver failure, that's an emergent thing. And usually it's typically a child who's totally doing well, and then boom, something happens, and they become rapidly unwell, they become very sleepy, seem to not be very coherent, and then obviously you can see the jaundice as well. And those are things that really alert us to them. There must be something wrong going on here, because the liver works to clear toxins away from the blood. And when it's not doing that very well, these toxins kind of like accumulate in the brain, and people get a bit confused, sleepy. So those are signs of an acute liver failure. So in terms of our team here at MedStar Georgetown University Hospital, we have a great and excellent team. So if I take it from our pediatric liver team, we start off with a group of hepatologists, pediatric hepatologists that start off care in babies, little children, adolescents with liver disease. Those same patients who need liver transplants, we care for them as well as transplant hepatologists. When they need surgery, liver transplant surgeons here at MedStar Georgetown University Hospital. We get liver transplants done here. And then these patients, when they do become adults, over 18, they transition to the equivalent of me here at MedStar Georgetown University Hospital. In terms of ancillary services that you need or that may be needed in the care of a child with liver disease or a child with a liver transplant, we have our interventional radiology services, hematology colleagues, our oncology colleagues. Essentially, really, truly, it's a one-stop shop. Everything under one roof. And so really for the care of a child with liver disease, the care of a child who needs a liver transplant, it's all under one roof here. So we have our child life colleagues who are really good at working with children and families of children who have a chronic disease condition. And so a lot of times as physicians, we sometimes tend to be focused a lot on, this is a sick kid and I need to do what I need to do. But I think really, truly, we need child life specialists to come along with us, and they do work with us and they work with families. And so they tend to we have ways that they can talk with families to speak about a diagnosis in a way that's not frightening for a child. They help. A lot of the work we do involves doing procedures, medical procedures on patients, on children, and so they help also when we have to do procedures, whether it's a liver biopsy, whether it's an endoscopy, whether it's a colonoscopy, any of these procedures, they come along with us and really help work with the families, work with the children, and really keep everyone at ease. And so they're really necessary part of our practice. I do what's called translational research. And so essentially what that means is you're taking samples from patients, be it, tissue, be it blood, be it urine, be it whatever sample from a patient, and then taking it to the laboratory and running tests on that. And so one of my main interests is really in immune-mediated diseases that we see before liver transplant as well as after liver transplant. And it's trying to understand, it's called an autoimmune type hepatitis, and it's trying to understand why everyone's getting the same protocol type medications, but Johnny has autoimmune hepatitis, but Janet does not, and why is that the case? Because we know that while it's not a large number of children, but because, like I had alluded to earlier, our focus is really on long-term care, long-term outcomes, I should say. And so it's important for us, things that can impact long-term outcomes negatively, it's important for us to try and address them. And so that's one an area of my interest in our research laboratory. What I love about my job is the good thing about kids is when kids get better, you can tell they get better. They don't pretend they're like all jumping up and down and very happy. And when parents, mothers are smiling, that's always a good sign. That's always a good sign. And so I love the fact that we have really critically ill children who come in, with liver failure, bad chronic liver disease. And with the medications we use, with our treatment options, we actually get kids better and kids can go home. And you can see the change in the child. Because the child who was skinny and, big belly with fluid in the belly and looking yellow, suddenly is a different kid. The yellowness is gone, the the nutrition is better and they're jumping up and down and able to go back to school. So I think for me, that's obviously very rewarding when we see that. Also, as I had alluded to earlier, I also have a research laboratory. And so we get involved in a lot of clinical trials as well, translational research trials, where things that we do from a research standpoint can impact positively the care of these patients. And so it gives me a lot of satisfaction when I do see our patients benefit from this. And you see a kid gets better, you see the parents looking happy. And I think that really, as a physician, makes me happy. Two questions I would say that pop up a lot. Is there something we can do about this? Can this be cured? And sometimes why? And so I think those two, maybe those three questions I said, come up all the time. And this is where research is important, because a lot of while we know a lot, there's still a lot that we do not know. And so one of the commonest reasons why a child in North America needs a liver transplant is a condition called biliary atresia. And there's a lot of research that we're doing into why children have this condition. And so we don't know the exact why, but we do know how to manage this condition very, very well. And then, so really, truly, there is the question of, is there a cure? Sometimes there isn't a cure, but we know how to manage this condition, because you can't necessarily cure all conditions. Some diseases do return. Some diseases do not respond to medical therapy alone, and you need surgery or transplant. And in that setting, once a transplant's been done, the disease may not come back. Depends on what type of disease one has. There's some genetic diseases that will not return after transplant. And then there are others, like some immune-mediated diseases can recur after a transplant. But the key thing I always tell parents is it's much better. Maybe the way I try to reassure them is, we know what to do about this. So that's a good thing, as opposed to not really being sure what we ought to do. I think it's always a good thing where, yes, we've seen this before. This is one of the things we expect that can happen, and this is how we address it. And I think, well, I like to think that, and I hope that's very reassuring to some families, the fact that actually the physicians have seen this before, and they know what to do about it. Yeah. They should choose MedStar Georgetown University Hospital is really because our outcomes, when you look at patient survival, graft survival after liver transplant, our outcomes are on par, sometimes even better than the national averages. And these are really these outcomes that that are available by UNOS on SRTR for folks to see. And so we're very proud of the work that we do over here.